Welcome to my channel Medicine Guide. Thank you for watching my channel Medicine Guide. Please subscribe to my channel Medicine Guide. How to treat serotonin syndrome versus neuroleptic malignant syndrome. So now first we will see what is serotonin. Serotonin, also known as 5-hydroxytryptamine 5-HT, and it is a monoamine neurotransmitter, and it also acts as a hormone. As a neurotransmitter, serotonin carries messages between nerve cells in our brain, and that is our central nervous system, and throughout our body, that is our peripheral nervous system. These chemical messages tell your body how to work. Serotonin plays several roles in our body, including influencing learning, memory, happiness, as well as regulating body temperature, sleep, sexual behavior, and hunger. A lack of enough serotonin is thought to play a role in depression, anxiety, mania, and other health conditions. Most of the serotonin found in our body is in our gut, that is intestine, and about 90% of serotonin is found in the cells lining our gastrointestinal tract, and it is released in the blood circulation and absorbed by the platelets. And only about 10% is produced in our brain. The serotonin is made from the essential amino acid tryptophan. An essential amino acid means it cannot be made by your body. It has to be obtained from the foods we eat. Now we see what is neuroleptic malignant syndrome. Neuroleptic malignant syndrome (NMS) is a rare and life-threatening reaction to the use of any neuroleptic medication. Neuroleptics, also known as antipsychotic medications, and they treat and manage the symptoms of many psychiatric conditions. NMS or neuroleptic malignant syndrome is characterized by the following: high fever, hyperthermia, stiff, rigid muscles that can lead to eventual muscles breakdown, altered muscles status, and autonomic nervous system dysfunction, that is dysautonomia. NMS is potentially life-threatening and requires immediate medical attention in a hospital setting. Now we see what is serotonin syndrome. Serotonin syndrome is a serious drug reaction. It is caused by medication that build up high levels of serotonin in the body. But too much serotonin causes signs and symptoms that can range from mild shivering and diarrhea to severe muscles rigidity, fever, and seizures. Severe serotonin syndrome can cause death if not treated. So serotonin syndrome can occur when you increase the dose of certain medication or start taking a new drug. It's most often caused by the combining medication that contains serotonin, such as a migraine medication and an antidepressant. Some illicit drugs and dietary supplements are associated with the serotonin syndrome. Now we see the symptoms. So first we will see what are the symptoms of neuroleptic malignant syndrome. Symptoms of neuroleptic malignant syndrome typically develop over 1 to 3 days, and they include: number 1, very high fever, 102 to 104 degree Fahrenheit. Number 2, irregular heartbeats, arrhythmias. Number 3, fast heart rate, tachycardia. Number 4, rapid breathing, that is the tachypnea. And number 5 is muscles rigidity, stiffness. Number 6 is altered mental status, and number 7 is high blood pressure or low blood pressure, and number 8 is excessive sweating. Now we see the treatment. So first we will see the neuroleptic malignant syndrome, how neuroleptic malignant syndrome is treated. Neuroleptic malignant syndrome (NMS) is a medical emergency, so quick diagnosis and treatment are essential. If you have NMS, you will need to receive care in a hospital setting, most likely an intensive care unit (ICU). In all cases of NMS, healthcare providers discontinue the use of the neuroleptic, that is antipsychotic medication, that cause treats the NMS. Treatment also involves treating the symptoms of NMS and preventing complications. Now we see what is the standard treatment for serotonin syndrome. Benzodiazepines such as diazepam, Valium, Diastat or lorazepam ativan can help control agitation, seizures and muscle stiffness. Serotonin production blocking agents. If other treatments are not working, medications such as cyproheptadine can help by blocking the serotonin production. What is the main difference between serotonin syndrome and neuroleptic malignant syndrome (NMS)? However, NMS or neuroleptic malignant syndrome is characterized by lead pipe rigidity, while serotonin syndrome is characterized by hyperreflexia and clonus. Precipitating medicines also allow differentiation. Dopamine antagonists precipitate neuroleptic malignant syndrome, while serotonergic medicines are indicative of serotonin syndrome. For both serotonin syndrome and neuroleptic malignant syndrome, immediate discontinuation of the causative agent is the primary treatment, along with supportive care. For NMS, dantrolene is the most effective evidence-based drug treatment, whereas there are no evidence-based drug treatments for serotonin syndrome. What is the first-line treatment for neuroleptic malignant syndrome? Treatment of NMS is individualized and based on the clinical presentation, but the first step is essentially all cases consist of cessation of the suspected offending neuroleptic pharmacological agent. What is the standard treatment for serotonin syndrome? Benzodiazepines such as diazepam, Valium, Diastat or lorazepam ativan can help control agitation, seizures and muscle stiffness. Serotonin production blocking agents. If other treatments are not working, medications such as cyproheptadine can help by blocking serotonin production. The drugs and supplements that could potentially cause serotonin syndrome include selective serotonin reuptake inhibitor, serotonin and norepinephrine reuptake inhibitors, SNRIs, bupropion, tricyclic antidepressants, monoamine oxidase inhibitors, anti-migraine medications, pain medications, lithium, which is a mood stabilizer, illicit drugs, herbal supplements including St. John's wort and ginseng and nutmeg, over-the-counter cough and cold medications, anti-nausea medications, linezolid and ritonavir. Next, disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only. Thank you for watching the video. Please subscribe to my channel, Medicine Guide.